And then I'll share my page here. Okay. Oh, hang on, sorry. Hang on, it didn't pull up the way I wanted it to. So hang on just a second. Okay, let's see. Okay, can you guys see that okay? Yes? Okay. Okay, so we'll start with the first concept, okay? This is a case study, okay? So we'll go through and get all the information and then we'll talk about what's the diagnosis and then nursing diagnosis that may apply to it and interventions and some rationales for those interventions, okay? So, your patient in this case study is a 17-year-old female whose chief complaint is not having had her period in 6 months. She's coming in an outpatient women's health clinic. Okay, so her history of present illness, which is what kind of the story is that's she's presenting with. Okay, that's what HPI looks for. Says MI reports absence of menstruation for the past 6 months. Menarche occurred at age 13. What's menarche again? You guys can unmute.
Menstruation.
Right. Yeah. Having her menstrual cycle for the first time, right? Cycles were previously regular every 28 to 30 days. She's not sexually active. Over the past year, she's had increased physical activity due to being in competitive sports and has had recent weight loss of 10 pounds. No pelvic pain, headaches, or visual changes. Okay, here's her medical history. So in your history, you want to do past medical history, medications, family history, any of this here that's looking like it would be helpful for you to know or kind of clue you into what's going on with this kiddo.
Stress, maybe.
Sorry, I couldn't hear you.
The academic reports academic stress.
Could be. Yep.
The low calorie diet.
Yeah. What else? What about in looking at family history? What under there seems important? Potentially.
No endocrine disorders.
Yep. Yep. Good. And then participating in competitive sports, right? Okay. All right. There's your physical exam. She's underweight BMI wise. She's Tanner stage 5. Okay. And she deferred a pelvic exam. So she refused for you to do a pelvic exam. Okay. Okay. So your diagnostic studies, anybody who's coming in, even if they're of childbearing age, even if they're telling you that they haven't been sexually active, it's still really, really important that you check for pregnancy. Okay. So in this kiddo, pregnancy test was negative, which it should be because she told you she wasn't sexually active. She has a low FSH and a normal LH. Okay. Her estrogen level is decreased. Her TSH or thyroid level is normal and her prolactin is normal. What do you think's going on with this kiddo? What's your medical diagnosis for this kid? Hasn't had period in 6 months, right? Participating, she's underweight and she's participating in active sports. What is it called when someone doesn't have a menstrual cycle? What's the medical term?
Amenorrhea.
Yes, good. Good job. So amenorrhea is what's going on with this case study, kiddo. Okay. So what are some nursing diagnoses that you could think of that would be appropriate for a kiddo with amenorrhea? Think back to your history. She was underweight. So what nursing diagnosis could you include for that?
Not meeting nutritional standard for BMI. I forget how it's worded.
Yeah. Imbalanced nutrition, less than body requirements.
Oh.
And that would be related to what?
Probably the low calorie diet and increase exercise.
Yep. What else could you use? She's really focused on her weight and wanting to eat healthy, right? That was in the history. What's another nursing diagnosis?
She could have like ineffective stress overload.
Yeah. What about, are there any nursing diagnoses like related to body image or anything like that? Mm-hmm. So what could that be?
Disturbed body image.
Uh-huh. And what would it be related to in this scenario?
Weight loss.
Yeah, weight loss and her competitive sports, right? Her strenuous activity. Yep. And then what else could you use for a diagnosis? Does it seem like she knows what's normal and what's not normal about her menstrual cycles? No. So what would be another one that you could utilize in this scenario?
Something about her not being knowledgeable.
Yeah, knowledge deficit, right?
Yeah.
Yep. And that would be regarding or related to not being aware of her normal menstrual function and overall health. Good. Okay. What are some interventions and then rationales for your interventions? What's the first thing you should talk to her about? She's underweight.
Her diet.
Yes. Nutritional intake. And what would go along in her case with nutritional intake that you should talk to her about?
Maybe a lifestyle factor.
Changing the diet and stuff due to like the extra activities and stuff like that. Like she has
Yeah.
higher activity and need to change compared to lower activities.
Right. Yeah, her exercise pattern and her nutritional intake related to that. Yep. Good. And in doing that, that would, in assessing her nutritional intake and her exercise pattern, how then, what's your rationale for using that as a nursing intervention? What would that help her accomplish?
A healthy weight where she's not underweight.
And where she's having regular menstrual cycles, right?
Yeah,
So she's not
yeah.
having an amenorrhea. Yep. Good. All right. And Haley, you kind of said another one, like educating the patient on the relationship between their BMI and nutrition and their menstrual cycles. Good. What else? Who could you send this kiddo to, maybe? Sorry, Fallon. Go ahead.
We could refer her, I guess, to like a counselor who's going to help her with different stress mechanisms
Yeah,
and how to
good.
cope.
Yes, good. Good. Who else could we refer her to? We're focused on nutrition, right? And
Dietitian.
yes, exactly. Good. Perfect. Alrighty. Oh, here's our next one. Okay, any questions about the first one? So amenorrhea was one category that you guys struggled with. Okay. On the Hesi. Okay. No questions? Okay, we'll move on. Okay, this is JR. He's a 15-year-old male. He suddenly fell and started shaking. He's in the ER now. Okay. He was brought to the ER by his mother after experiencing a sudden episode of loss of consciousness, generalized body stiffening, rhythmic jerking movements lasting approximately 2 minutes. The mother reports post-event confusion and fatigue lasting about 20 minutes. This is the patient's second similar episode in the past 3 months. Okay, what are we thinking is going on with this kiddo?
Seizure.
Yep, a seizure. Good. And what sort of seizure? Here, I'll go back. What type?
General tonic-clonic.
Yes, generalized or tonic-clonic. Yep, good. Okay, here's the past medical history for this kiddo. No recent head trauma, no medications. What else? Anything you're seeing that might pop up? Might be helpful for you to be aware of.
Family history.
Yeah, family history of epilepsy. Good. Alrighty, here's your physical exam. Everything looking okay there? Or is there anything looking abnormal?
ANO times 3.
Yeah. But it also says what? Fatigued, right? Alert and oriented, but fatigued. Okay, good. All right, here's your diagnostic studies that go along with the kiddo that you think just had a seizure. Okay. So normal blood glucose, you always want to check a blood sugar on a kiddo that had a seizure to make sure that they're not having like hypoglycemia or hyperglycemia. Okay. You also want to check your electrolytes and then an EEG. So in this case, the EEG was abnormal. So consistent with epilepsy. And then the brain MRI in this case was normal. Okay, so we already talked about generalized or tonic-clonic seizures that this kiddo is having. So what are some nursing diagnoses?
Risk for injury.
Yep, and what's your related to?
Seizures.
Yeah, I know. That's what you want to say, isn't it? How about you could do
Jerking.
loss of consciousness or, related to sudden loss of consciousness or related to fall. But yeah, I would probably do. Oh, go ahead. Sorry, I couldn't hear you.
I was just an uncontrolled seizure activity.
Yeah, good. Okay. And then what else? What would be another one? What about for the mom? Didn't seem like she really knew what was going on, huh?
So that's the knowledge deficit
Uh-huh. What's your
for
related to?
mom. Oh, I don't remember.
How about
Fatigue.
seizure management and
Yeah.
safety? Yep.
not
Good.
understanding the diagnosis fully.
Yep. Good. What else? Is there any like mental health nursing diagnoses you could use for the kiddo or for mom? How about anxiety or risk of anxiety, right? Fearful about recurrent seizures or having seizures again, right? Good. What else could be a diagnosis, a nursing diagnosis? So someone who's had seizure activity, they're going to be fatigued and kind of in that post-ictal period, right? So are they going to be like having great mobility after that? No. So what's a nursing diagnosis with that?
Impaired physical mobility.
Yep. Good. And related to seizure activity, right? There you go, Fallon. That's what you wanted to use before. Yeah. And then Cameron said safety risks, right? Good. Or yeah, impaired perception. Good. Okay. Now your nursing interventions. What are going to be your nursing interventions for this kiddo?
To place the patient on the left side, timing the seizure activity,
Yeah.
grabbing vitals
Mm-hmm.
after.
Mm-hmm.
Educating.
Yeah. So what about if they're in the hospital? What are you going to have kids who have had seizures? What sort of protocol are you going to have them on?
Padded side rails.
Fall risk, high fall risk.
Yep. Good. Yeah. Seizure precautions, right? Good. What is the purpose or what's your rationale for maintaining seizure precautions on a kiddo who's had seizures?
Safety.
Safety. Yep. For reducing the risk of injury. Good. And then Fallon talked about monitoring and documenting seizure activity. So watching for how long it's happening. The other part of that is, what triggered it, what type of seizure activity they're having. Is it absent seizure where they're just staring off? Or is it a full-blown generalized tonic-clonic seizure? And in knowing,
I have a question.
Yeah. Uh-huh.
I kind of sort of remember this question.
Uh-huh.
They were talking about, like she mentioned earlier, the padded side rails,
Uh-huh.
but one minute they're telling you don't put the pillow against the side rails, and the next minute they are saying use the pillow for the side rails. Which one is it?
Yeah, so they make actual pads, not necessarily the pillow,
Okay.
for side rails. So they make like an actual padding that you can go that goes along those side rails.
Okay.
So
Gotcha. I didn't know that.
I'm not sure exactly what the question is. I can't go in and see the exact question. I can just see topics from the
It was like
question
a
that were
select.
most
It was
missed.
like a select all apply. I remember it too.
Uh-huh.
It was asking like what the patient needs for like a seizure protocol, basically.
Uh-huh. So what's all involved in that? So like bed in
Mm-hmm.
low position, padded side rails, making sure that, they don't have anything sharp or anything like that that could be around them that they or hitting their head. Um, things like that. Yep, laying them on their side. Yep, good. What else would be a nursing intervention for a kiddo with seizure disorders?
Educate.
Medication coherence.
Yep, medication. Good. And then Tori, did you say education?
education about
Yep.
the medication, the
Yep.
importance of staying on it.
Yes. And the consistency of doing it at the same time of day and all of that. That's really important with seizure medications, that they're not like, delaying it because someone's sleeping in or something. Good. Yep. And then emotional support and reassurance to the parent too would be helpful. Okay. Any questions about that one before we go on to the last one? Okay. All right. So 14-year-old female, she's complaining that her shoulders look uneven. She's in an outpatient orthopedics clinic. Okay, so she was brought to the clinic by her mother after noticing uneven shoulders and an asymmetry of the waistline over the past 4 months. The patient denies back pain, but reports occasional muscle fatigue after prolonged sitting. Menarche occurred at age 12, growth spurts noted within the last year. Okay. Well, that's kind of hard to see. Okay. No chronic illnesses. I'll read it to you. No previous surgeries for past medical history. Medication. She's not on any medications. Family history. Mom was diagnosed with scoliosis as an adolescent. Social history. She's a middle school student. She's active in school activities, and there's no history of trauma. Okay, on this page, what is jumping out at you guys?
Scoliosis as adolescent.
Yep. Good. Okay. So on your physical exam, all vital signs are normal. And then your posture, you're looking at the right shoulder is elevated and asymmetrical waistline, which is a part of what she was complaining about. Your Adams forward bend test, which is where you have them bend over to touch their toes, right? Legs together, bend over to touch their toes. That's something you as a nurse would potentially be checking, especially in the school setting on pediatrics. Okay. So you observe a right-sided hump. So the right side is higher than the left side. Okay. And then neurological exam is normal. So what is that forward bend test cluing you into?
Scoliosis.
Yeah, exactly. Diagnostic study wise, you'll do an x-ray of the spine, and then you found a Cobb angle of 28 degrees, which is telling you that there's a 28-degree curvature. Okay. Which isn't super duper significant, but significant enough that on physical exam, you would be able to notice a difference. Okay. Okay. So what are some nursing diagnoses you can do for a kiddo with scoliosis?
Disturbed body image.
Yeah. What's your related to?
The
Can't use scoliosis. Yep.
the curvature.
Yeah. Postural asymmetry would be another way to say it. Okay. What else? What's another nursing diagnosis you could use?
Impaired mobility.
Potentially have pain.
Yep. What would you be related to, Elizabeth? We can't say scoliosis.
Curvature of the spine,
Yep. Good.
unable to bend properly.
Yeah. Yep. All the ways you could say scoliosis without saying that diagnosis. Uh-huh. What else?
You could have a risk for social isolation.
Uh-huh. Yeah. Once again, because of the body image, right?
Yes.
Uh-huh. There's another risk for one that I'm thinking of. So if their curvature is severe enough, what could it potentially affect?
It could cause pain.
Breathing.
Yep, pain,
Growth, like
Breathing.
breathing. There you go.
Respiratory.
Yep. Risk for impaired gas exchange. Yep. Good. All right. What else? One that you can almost always use as a nursing diagnosis. Knowledge deficit, right? You can't think of anything else. You can almost always use that one. And that would be related to the management and treatment, right? Good. All right. Now some nursing interventions. What can you do as a nurse with a kiddo with scoliosis?
Maybe like physical therapy.
Teach them how to wear the brace.
Massages.
Yeah. So physical therapy, right? Talk with them about doing physical therapy and the importance of it. Talk with them about the importance of their brace. How long if they do have a brace, sorry, Elizabeth. If they do have a brace, how long or how many hours out of the day do they have to wear it?
23.
23.
Yep. 23 out of 4. What would be the important thing with somebody who has a skin brace or a brace?
Skin,
Yep.
skin integrity.
And integrity.
Yep. So you'd be checking for that and making sure that they're not getting any skin breakdown. So would they wear their brace under their clothing or over?
Over.
Over. No
Yep.
lotions.
Yep. Good. Perfect. Haley, you said something too. I couldn't hear you. Somebody else said it.
Yes, ma'am, I did.
Okay. Perfect. Okay. And then do kids who have scoliosis always get a brace?
No.
Oh, it depends on the curvature if they need the surgery instead.
Yep. Yep. Or if it, less than a 15-degree curve or a 10-degree curve, then a lot of times they'll just do an observation. So, you may have to do another repeat x-ray in, the next year or something. Good. What else would be important nursing intervention wise for this kiddo? So they have a brace.
They may need coping because they're not going to want to be different.
Yep. Yeah, that body image thing again, right? Good. So they have a brace in place. So how would you know, or how could you check on if things are getting better? What would be some things that you could do as a nurse?
Well, I guess you can't repeat x-ray because you can't order it, but
Right. But yeah, repeat x-ray. But what could you do as a nurse?
Reassess.
Yeah, do that Adams test again, right? Yep.
Making sure they have follow appointments.
Yes, yeah, the importance of continuing follow-up. Yep, good. All righty. Good job. All right, so I'm going to stop sharing. Those were the top 3 things, okay? There will be a recording from this class. Do you guys have